A new report on cancer treatment in the South Island paints a bleak picture of a system failing hundreds of patients and their whānau. The Health and Disability Commission started the investigation after being alarmed by appalling cancer treatment statistics of patients suffering harm due to long wait times. The report assessed how the Southern District Health Board, now Te Whatu Ora Health New Zealand Southern, delivered its non-surgical cancer treatment services from 2016 to 2022. Daniel Pallister-Coward is the Regional Director at Te Waiponamu Hospital and Specialist Services at Te Whatu Ora, and he's with us now. Tēnā koe, Dan. Thanks for joining us.
Kia ora, Neil.
Now, the report says hundreds of people have suffered harm due to long wait times. What do you feel after hearing and seeing that so many people are suffering this way?
Yeah, look, this report's probably a really sobering reminder of the impact that long wait for treatment with people for cancer have suffered. And I suppose I'd like to start off by generally saying, look, we do offer our apologies to those that have been directly impacted, as well as their whānau.
Well, doctors and clinicians have been vocal about how bad things have become. How do you respond to accusations that upper management is failing to recognise and respond to this crisis?
Well, I think the valid points that our clinicians have raised have resulted in a number of changes since that the report has come into place. I think the things that we're doing now and that we have been doing in preparation for coming together under Te Pai Ora legislative changes and bringing together in terms of the DHBs has resulted in us to respond to those concerns, put in plans in place to able to react to the pipeline of training and also to ensure that we've got pathways in place for people today.
So are Southland's cancer treatment services seriously underfunded, or is there more to it?
I think the core to some of the challenges that we are seeing today has been our workforce challenges. We are competing in a worldwide market for a number of resources that are scarce. And I think that's why we've really put our efforts into doing a range of actions, both increasing the pipeline, so increasing trainees by 5. We've also looked to how do we appoint recently 2 senior registrars. We're actively recruiting. So there's other pathways in terms of providing care across the motu, looking at our total resource and capacity and ensuring that we're able to support whānau to be able to move around where treatment can be provided more timely.
Now, the report criticises poor clinical governance systems, inadequate quality control measures, and a poor relationship between doctors and management. What's Te Whatu Ora doing to address these issues?
Over the last 2 years, we've really strengthened our clinical governance and performance accountability processes. We've rebuilt our risk management systems and we've really put processes with a key focus on clinical risk.
So how soon, Dan, do you feel that your situation in your particular area will improve?
It's a good question. I think it's an ongoing one. We've got some actions in place today that ensure confidence around providing treatment. We know that 90% of patients that are starting treatment are within the expected timeframe, and that's despite some of our constraints. We know we can do better. I believe the pathways that are in place already are starting to address that. I know that the pipeline starts securing our future workforce, and what we need to do is secure both the pathways and the workforce that we need to continue today.
You've reassessed lots of things, you've changed jobs and roles and made sure that you're in the right place. Are we talking 2 months, 6 months, 12 months before we see improvements?
Well, I think some of the gains we've made already demonstrate the pace. We have a national group coming together already, working on that. I think it's multifactorial. There are different things that are in place today that are making improvements today. There will be different changes as more workforce comes on, and the future looks better with a different approach to our pipeline and our training.
And you really feel that this is going to be very helpful for those on the wait list?
I do. And a number of the things that we have done in the past is around supporting those that are on the wait list. Our pathways recently are looking at how do we support, including radiation oncology as an example, by sharing a number of the resources nationally makes a difference for the people on those pathways. we need to keep doing more, and it's about bringing our clinicians together.
We should probably catch up again in the near future to just update on how things are going. Daniel Pallister-Coward from Te Whānau, from Te Whatu Ora, Te Waipounamu. Thank you again for your time today. Ngā mihi.
Yep.